Welcome back. We are continuing the conversation about spring allergies. I recently spoke with Dr. Tania Elliott all about how you can alleviate symptoms and help wherever you may be. Let's take a look.
Spring has sprung, and for many, this is good news given the particularly rough winter we experienced. But for approximately 66 million Americans with eye allergies, the warmer weather brings itchy eyes and a host of allergy triggers, whether they're outdoors, smelling the roses, or hanging at home with their pets. If you're one of millions dealing with itchy allergy eyes, nationally recognized board-certified allergist Dr. Tania Elliott has tips to get you quick relief and back to seeing spring through fresh eyes. Dr. Elliott, thanks for joining us.
Thanks for having me.
So what trends are you seeing this allergy season that our audience should know about?
Each year we start to see that allergy season starts earlier and earlier and lasts longer and longer. It's a combination of three things. One is above average temperatures. The second is more than normal rainfall. And then the third actually relates to pollution and climate change. There are lots of pollutants in the air that stay suspended in the air and can combine with pollen. And so what we're seeing is actually these super pollens that can be very, very irritating to the nose and the eyes.
How can people identify whether their symptoms are from eye allergies rather than dry eye or just general eye discomfort?
Yeah, it's tough because lots of the symptoms overlap. Sometimes people with dry eyes could also feel like a grittiness or an itchiness. For the most part, though, allergies itch. And the mechanism behind that is a chemical called histamine. So when you have an allergy to something, your allergy cells release a chemical called histamine, and that's what's responsible for causing itching. So that tends to be the main symptom. The other way you can tell if it's allergies versus something else is how frequently you're having the symptoms and whether or not they fluctuate based on what you do. So for example, you're doing fine when you wake up in the morning, then you go outside for your run, and all of a sudden your eyes start to bother you, and then you come inside and your eyes are still bothering you. The likelihood is that's allergies. If you wake up in the morning and your eyes are dry, and then all day long your eyes are dry, 24/7, 365, the likelihood is that it's not allergy. So kind of keeping the sort of history in mind, and then seeing an allergist who can help actually do the test and identify what it is that you're allergic to, if anything.
If someone does have eye allergies, how can they start to treat itchy eyes?
So I'm going to give you two tips. One's not a medicine, the other one's a medicine. The non-medicine tip is, especially if you're going outside and you're experiencing itchy eyes when you're outside, and then you come inside and your eyes are still itching, it's possible that the pollen has gotten stuck in between your eyelashes. So what I recommend to my patients is actually doing eyelid scrubs with a fine bristle brush and a little bit of baby shampoo. Scrub your eyelashes and get rid of that pollen that might have gotten stuck in there that's causing you to have symptoms all day long. The second thing I recommend is, remember that chemical histamine, I recommend an antihistamine eye drop. So not very many available over the counter. There's one, it's called Pataday Once Daily Relief Extra Strength. It's a single antihistamine eye drop that treats the source. So one drop and you're covered for 24 hours. So that's my medicine go-to.
What are the top issues you hear from your eye allergy patients?
Lately, I've been hearing, why are my eye allergies so bad now? And it really goes back to how we're spending our day-to-day lives and how it's different than how we were spending it, probably not similar to last year, but certainly the year before, where we're spending more time in the house because we're working from home. So if you've got pets at home, you're spending more time around your pets that could be triggering your allergies. And we're doing more social activities outside. So we're not going to movie theaters, not going to restaurants, spending more time outside means more time exposed to pollen. So it's really that our day-to-day activities have changed, and it's causing us to be more exposed to allergens than we previously used to be.
And where can allergy eye sufferers go for more information on treating their seasonal eye itch?
Check out Pataday.com, where you can get more information on where to get the Pataday Once Daily Relief Extra Strength drops, as well as other tips and tricks like the eye scrubs and other things that you can do to stay allergy-free this season.
Thank you so much, Dr. Tania Elliott, for joining us today here on Park State Television, giving us this important information about eye allergies.
Bye.